We welcome our last keynote speaker for today, Elhag, specialized therapeutic consultant at Bayer, innovation coach, founder of HealthLy app digital healthcare solution. HealthLy is a digital therapeutics app that sparks changes in patient behavior and improves health outcomes. HealthLy stores and analyzes data of the whole family related to therapies, interactions, health parameters, symptoms, and visits to the doctor. HealthLy app solution features profiles, multi-profiles, therapies, measurements, appointments, injection map, medical locator, HealthLy personal medical record, patient safety, a health indicator for monitoring and improving health through analysis and the ability to predict potential patterns and timely reaction. Haris, the stage is yours.
Okay, hello, good evening. My name is Elhag, and first of all, thank you for the opportunity to present our solution. And HealthLy. What is HealthLy? HealthLy is a digital health management system for whole family. And why? Because 6 out of 10 adults suffer, for at least one of chronic disease. And this is average around 40% of, just later, 40% of population in each country have at least one chronic disease. And if patients don't take medicine on the time and in the right dose, it is very important if we want to heal patients, to engage them, to take medicine on time. It's a rate around 50% of all patients in the world don't take medicine on time. And because of that, 10 hours and more than 10 hours, every physician take care of these chronic patients per day that is uncontrolled. They don't take medicine on time. And what is HealthLy? HealthLy is a digital therapeutics, and we want to change behaviors of patients to take care of their own health. HealthLy stores, analyzes data for whole family related to therapy, indicators, health parameters, symptoms, and all visitors to doctors. And you can see here, we have option that one users who use digital HealthLy app can add multi-profile for children, for parents, even a pet, and for themselves. This is some of the features, multi-profiles. One profile is open, pod profiles, daughter, some patients or mom or whatever else. Therapy, they enter whole therapy that they can take, and they have reminder. Every time when he set this therapy, he gets message or notification that it's time for the medicine. And here is a measurement indicator. This is health and laboratory. You have cholesterol, blood pressure, and more than 85 parameters. Of course, here is appointments. They can put all appointments and medical examinations or control what they can do and planning to do, and when they finish, they're going to be in the past. And this is very interesting because when he finish this examination or visit to the doctors, can add all this documentation and put in this particularly checkup and storage all documentation here. And when the patients arrived in another city, another town, you have some problem, just open the phone and say, okay, sorry, I visit my cardiologist, and please take a look at my examinations and what is my condition. Here is injection map. Because we have patients who take at home injection therapy, we know diabetes and insulin. And what is important? To learn patients to properly apply injection. You know, every patient has some favorite place, it's the abdomen, but this is not good for a long time period to apply injection. And this system, learning patients how to rotate. They change colors after every 2 days, and green is his place when he can apply another injection. And now also here is locator. If you arrived in some new city or new country, you just open the HealthLy app and see the whole pharmacist and hospital emergency centers here in the app. To be easily for the patients to enter whole therapy, you know, when you go to pharmacy, see that the patient take 10 to 11 boxes of medicine. Not need to write this in app, just simply scan the barcode or QR code, depends on the package, and this therapy enter in HealthLy app and just set up the time and date when they take. And here is data. Every patient takes some therapy and put some laboratory parameters or health parameters, weight, height, temperature. Here is a personal medical record. We have 3 types now: personal medical records, head-to-head, and timeline. Personal medical report, all data that patients have. This is a peer-to-peer, patients to doctor. If agree, patients can send, just click on this and send all data for some of time period. For example, we agree with the physicians. They say every 2 weeks, please send me your blood pressure and I want to see your blood sugar and the therapy that you take. And they click. This one, head-to-head, this is very interesting. And this is interesting because we can see how it's improved therapy and health parameter that we want to check. Patients have high blood pressure, and they take some therapy for high blood pressure and enter after 2 hours what is the value of the blood pressure, and physician can see timely head-to-head. It's effective therapy to blood pressure. And this timeline, this is all what activity per 1 day, per 1 month, and whatever physicians want to know. This is some example how it's look. You can see blood sugar 5.9, 8.6. This is blood pressure. And this is very interesting because when we discuss with physicians, they can see, can remotely monitoring the patient. That's reduce the crowd in office. We know how it's situation when you go to the hospital. Too many patients, and they waiting maybe just to doctor see the results of blood sugar and to say, okay, it's everything okay. And this is a benefit in advance of using something like HealthLy, digital tools. They can send to the doctor, and this triage. This is very important because the physicians see the results and can say patients, okay, it's everything okay. We can arrange another control and check up after 2 months. But if he sees something it is not in a normal range, they can say, please visit your doctor in the next few days. This is how the doctors see what therapy. This is example. This is not right patients and users. If you have some doctors or pharmacists here, but just want to show how they can see the therapy per time, what they use and how it's be planned to take this therapy. This is adherence, because if the patients take medicine on time, we know the health can be improved. And this is what they say, injection, the system is learning. You can see a red spot, just apply. Orange, patients apply here 2 days ago. Yellow, I don't know yellow. I don't have this yellow here. It is 5 days, and green is up to 6 to 7 days. And patients learn to rotate the place. Okay, we can see now different indicators and parameters, blood pressure, glucose level. And this is very interesting because some of patients and doctors and pharmacists ask us, we have oldest people, they don't use smartphone, or they use smartphone but not familiar with this digital app. But we create this multiple profile system, and someone who cares for them can open the pod profile and add his mother, father, or grandfather and sit at home at Sunday and put all this data and just click and send to the physicians. It's a simple. Just enter the email address that you want to send and just select the period of time that the report is referred. Automatically it's set for 1 month, but you can choose for 1 year if you want, but this is not usually around 2 weeks or 3 weeks, and just click here and send to doctors to analyze all data. You can see here we have more than 85 plus indicators they can add. And we can see this is peer-to-peer, patients-to-doctor connection. And this is encryption, and this is only by doctors and patients can see. But this is data what we can export and to analyze for some improvement of medications or some clinical study or something. I take some examples, and this is patient for cardiovascular disease. And we can see what they entered. Most of them enter blood pressure. You can see this is red, this is the top 10 parameters that the patients enter, and we see the average of parameters that the patients enter, it's 8.6, okay, 9. And what we saw, if we give patients some tools and to be easily to use, they take care of their health. And this is a patient engagement, and this is very important for health. Now it's patients with thrombosis management. Also, what they put, because of thrombosis, they must check ENR, and most of patients take ENR. And this is target partnership, pharmaceutical company, clinical research, nursing home, hospital, pharmacist, and insurance. Why insurance? Because we decrease the cost of hospital, how to say, because the patients is in adherence and they are very well health. Nursing, because this multiple system, it is allowed you not to put only the people you care in your home, you can add your patients here. Also, that's going to use also the hospitals, and for clinical research is data is very important, also for pharmaceutical company. Oh, sorry. And this is what offer HealthLy as data, big data, and this is real data directly from the patient, directly from the user, directly from the people who suffer from some chronic disease or not. Just documentation, whole documentation that patients have put in phone in this HealthLy app, and the therapy and health indicator, and this can improve when you analyze. You can predict some patterns for the future and timely reaction. And it is very interesting for clinical research, launch new drugs, additional monitoring for medicine, and effectiveness of therapy and profile user. Okay. The age, you can see for 40 to 70, this is main impact of user. This is nearly 65% of patients. Now we have 46 and much more users in our database. And this is a short overview. Check and track, support, and this is very interesting. We have also educational corner. Every physician who care about his patients, or every company that have a content for general public, we can put here, and patients we know, they go to the physicians and they get this list and say, read this, you don't eat this, you don't eat this, you must exercise. Mostly patients, this put in his bed and leave this. Don't read. But if you have a phone, we say, please, one time for health. What that mean? They use phone, and sometimes they open this and say, hey, I can read this or to see my doctors. Because we know we living in this fast time, and people want to see something that is very, very easily to explain and enjoy in the bed. Okay. This is some of additional features that we have. If they have some message to notify, I give example for World Health Day, but everything what is interesting for some company that be incorporate with us can put here. Also, can analyze a questionnaire or survey. Put a question, we send, and they give a notification. It's anonymous, and they can answer to this question. Now we have English, Serbian, and Spanish language because we registered also in USA, but absolutely expanding the language, it's planning. We are digital health and we must respect all these rules, and GDP compliance and security, it is very important, but we are working in HIPAA standards and this is not a problem. What is HealthLy? It's database, user-friendly, secure collection, and data export for analyze. Advantage? Okay. If we have some program like biostatistic, artificial intelligence can use all these data and to see and to analyze. Also to connect with wearable device. Now we are synchronized with Apple Head Kit and with Apple Watch, a smartwatch can be connected with our applications. Now it's report sharing, personal records, medical resource, education, this is very important. And all this data can be used to analyze and to see what is the main problem for the patient, what is improving health and how it's going on with all these patients. And here in Serbia, we have great cooperation and support. Our app is Bayer company and also Novartis here in Serbia. They support patients who take their medicine to use this app. This is our team. Vladimir, Mijat, Nikola, me, also this is Snežana, Nebojša, and Lazar, and I'm only today with you. And you can find us on here to download for free this app and start to use for you or for your family. Thank you. I'm ready for question. Yes.
Thank you so much. I was wondering about the user experience part. So there's a lot of information there to be analyzed and used as an output. But what about the input? How the user is inputting the data?
Thank you.
And also, if it's connecting with tracking devices, for instance, smart watches and so on.
Okay, thank you. For smart watches, it is go automatically because they just when they install our app, they show do you allow to connect with this, that allow, and everything what the smartwatch have and also what the app have, but we synchronize to be similar, they enter. But all data we want, and from the experience, my previous work was I work in emergency service, and we want to learn patients. In the future, we planning just to be artificial intelligent when they put the phone and scan all laboratory parameters, they enter. But now we want to learn patients to enter, to learn what is important for them. I know it's easily to do on this, but because of that, when you saw this, and thank you for the question, this is interesting, and this one, you can see we have 85 plus parameters, but they use 11. Because it depends on the disease, they choose, this is red only top 10, what is very important for them. And we don't want to patients have too much data because they don't understand. For them, for example, from thrombosis, for them is weight, blood pressure, and also ENR with therapy is important. And because of that, we leave for now to patients enter by themselves. And now it's going okay, they satisfy. But if we see in the future, because periodically we send some enquete for patients to answer to us, does they want something? We propose something. If they say they want to scan, and you know when you go to laboratory, you put you more than 40 analyze, but that's for patients it's not very important. It's important for physicians, for them. Physicians say to them, because this is a health monitoring, and at home, they say, please measure blood pressure and blood sugar. This is very easily to bet, but in the future, if some company who have wearable device and want to connect with us, we are open and we connect all these things. Thank you. Anyone else? Damian? I know. I don't know. It's going. It is going very well because you can see the number of the patients increase. Yes. And the age for us, it's very good. We are planning and we are thinking that's gonna top 3 is from 40 to 70 years, and we can see that the oldest people use smartphone. What they need, they don't put TikTok, Facebook, or something if they don't use. They think about their health and they take this app because we cooperate with Bayer and also Novartis, and they promote this to the physicians. And physicians, when treat their patients, they say, please, we want you to take care of your health, to enter our therapy, to take your therapy on time, to be in good adherence, and patients install this.
Go back on the other slide. 0.1 of 70, the statistics. Yeah, 0.5, 76 plus, 76 plus, 1.5%.
Yes.
Is there we are speaking about the double connection with the younger members of the family?
Yes. We don't export now here pod profile, but with the older, this is mean this other. This is mean this other. Someone take care of them. Okay. People oldest, more than 67 years, they don't use too much, but we have some. But this is this is other. Someone take care of them. But in the future, we think that the number is growing because we have now meetings in hospital Sveti Sava, and also they want to patients who suffer. This is cerebrovascular disease. This is a stroke patients, and they know that patients can be used by themselves because they in the bed, but someone take care of them. Is this a member of family or it is some external caregiver? But to take care and to use this app to be patient adherence and to enter all parameters just to send. And we're expecting that this number is growing for the oldest people.
No, that's amazing. That's one of the best parts of the app. The other part that I'm interested in is in America active the finding the cheapest drug around you with the geolocation or not?
Now we focus now here is from Serbia also. Just from Serbia. From USA when we had a conference in USA.
Okay.
Thank you, Diane.
Thank you. I have one more.
Okay.
What about pharmacovigilance? I think it's also called in English.
This is a great question. We are focused here for data, but just to show, I think it's gonna be and here, report a drug side effect. Sorry, because now we focus on this data, what we can export, but this is also a main question, and PV, it's very important also for all patients and physicians, but especially for pharmaco industry. And we put here reporter. It is simply, the patient can click only here, and in Serbia, go to our agency. On link, directly, is everybody here on Serbia? Prijavite or report, PV report, okay. And this is easily, I have this, oh no, my phone is out there, but if you want to install, and please check its work. For USA, go to link of FDA. And when the patients click, they open and say, you are from Serbia, ALIMS, you are from USA, FDA. And you click your country. And in the future, when we put another, we're planning now Croatia and Slovenia also, another country in the region, they go link for PV also to this agency. Thank you. Thank you for this question. This is interesting, but we think about this and put here. And it's very easily to report this. And we encourage all physicians, nurses, and patients, because they think if say some reporting, they have some obligation. We say no. This is very important to know what is going on with the medicine, and to explain them this is no obligation. You just report this, and this is enough for you, and they check another. Okay.
Okay. No more questions? Think not.
Thank you.
Harris, thank you. I would like to thank Harris for this amazing presentation, and I would like to thank all of you for being with us today. I hope that you found the talks both enjoyable and informative. Your presence has truly enriched our conference. We will meet back here again tomorrow at 9:15 a.m. Thank you once again, and have a pleasant rest of the day. Thank you.